Welcome back, everyone. So in this video, we're going to look at chapter 10 of orofacial, and we're going to look at tooth identification. And this is actually a very interesting chapter because it tells you how to identify each individual teeth. And we're just going to examine permanent dentition right now. So we're only going to examine the adult dentition. Now, you guys all know how to name teeth. We have permanent teeth and deciduous teeth. We have the maxillary arc and the mandibular arc. We have the right side and the left side. And one of the things we're going to look at today is how do you distinguish a right incisor from a left incisor? How do you distinguish a right canine from a left canine? And so on with the premolar and molar. So here are some rules of tooth identification. The first one says that the curvature of the CEJ is 1 millimeter less on the distal than on the mesial. What does that mean? What does it mean when we say the curve is less on the distal and more on the mesial? Well, I'm going to show you. Let's see if I can find a tooth. So let's look at this one. I'm going to make it a little bit bigger for us to see better. This is right here. This is a maxillary first premolar. When you look at the mesial side, what's supposed to happen is this curve. This is the CEJ, this cemento-enamel junction. This curve is on the mesial side slightly more curved than on the distal side. The distal side is typically a little bit more flat. The distal side is what they're saying is 1 millimeter less curvier compared to the mesial side. So the mesial side is always more curvier, has more of a curvature compared to the distal side. Okay, so mesial, more curvy. And I actually have, if we look at my slide, I'll actually show you some pictures where we can actually see this. So for example, right here, the permanent maxillary lateral incisor, look at the mesial. Do you see that dip? So mesial has more of a curve here at the CEJ compared to the distal. So when you look at two teeth, and if you don't know which side is the mesial, which side is the distal, one trick you can look at is the curvature of the CEJ. Let's look at the second point. So we looked at the first point, which is the curve of the CEJ is 1 millimeter less on the distal compared to the mesial. So the mesial is more curvy. If the tooth roots curve, they usually curve distally, especially at the apex of the root. So let's see that. When the roots curve, they curve distally. So if we look at the pictures or the images right here, look at all the roots. Do you see how they have a slight distal inclination right here? When you look at the apex, do you see how they curve? When they're curving, they're actually curving distally. So the roots that you're looking at here, they all curve distally. So if you don't know mesial to distal, one thing you can do when you have a single tooth to look at is look at the roots. If the roots are curving this way, then you know this is the distal side. Okay, so oops, this is actually, you know what? Let's just open this up so we can see this better. So this way is distal because the roots go distal. Okay, so the roots always curve distally. Another point that was made over here, so we looked at the CEJ, it curves more on the mesial. The roots curve distal. And then here's another one. On the anterior teeth, so in the anterior teeth, the distal incisal edges are more rounded than the mesial incisal edges. What does that mean? Okay, well, let's look over here. When you look at the permanent dentition, this is the midline right here. So if I'm looking at this teeth over here, I'm actually going to make it bigger so we can see better. If I'm looking at the distal of the 1-1, see how the distal is rounded? Whereas the mesial has more of a 90-degree angle. It's more sharper over here. It's not as rounded. Same thing with this side. It's more rounded on the distal, less rounded. It has a 90-degree angle. It's more sharp here on the mesial. And you can see that with all anterior teeth, it's more rounded on the distal, not so much on the mesial. And the mesial is like a sharp. You can actually like see like a sharp L over here, right? Like it's a sharp right angle. So distal is more rounded. Same thing with the mandibular central incisors and lateral incisors, and we'll see it more. It's hard to show you over here, but we'll see it more when we look at that tooth individually. Okay, so let's look at more rules, more tooth identification rules. Mandibular anterior teeth tend to wear on the labial incisal edges, whereas the maxillary teeth tend to wear on the lingual incisal edges. What does that mean? So again, I'm going to look at this picture here. So it says mandibular teeth wear on the labial, and you can actually see this over here. When you're looking at the mandibular teeth, where they touch. Okay, so if you look at when the teeth closes. So when the jaw closes, when the maxillary and mandibular meet, can you see how the labial or the front surfaces of the teeth would be hitting over here would be hitting by the maxillary central incisors? So you would see more wear on the front, on the labial. Okay, so for the mandibular incisors, if you see wear, if you see some like what we say attrition, or you can also call it just wear and tear that typically happens, you would see it on the labial. So the more you bite down, the more you grind, the more you clench, you're going to see more wear on the labial surfaces, on the front facial surfaces. But with the maxillary, okay, with the maxillary incisors, where do you think you'll see more wear? On the lingual. You would see more wear on the lingual surfaces, because when they close, when the max and man close, the mandibular incisors hits the lingual surface of the maxillary incisors. So in the maxillary, the wear you would see, the wear and tear that you would see would be on the lingual side. In the mandibular incisors, the wear that you would see would be on the labial side. That's what that point was referring to. Another thing it says here is permanent molars are generally smaller in height and have fewer cusps the more posterior they are positioned. And that can also be seen here. So when you look at the posterior molars, you'll notice that the first molar is always big, second molar is a little bit more smaller, and third molar is even more smaller. So it goes big, a large, medium, and small, for example. So it starts off big and works its way down smaller. So it gets smaller as you get posterior. That's what that point is. And in fact, another fun fact is if you look at the roots are more flared in the first molar. They get more closer together in the second molar, and in the third molar, they could be all fused. But you can see here the roots are a lot more closer together. Okay, so it's more opened or flared in the first molar. It gets closer. The roots come closer in the second molar, and in the third molar it gets even more closer. It can be fused, and you can see the same pattern in the mandibular posterior teeth. So it's the same for mand and max. And lastly, what it says over here is that the permanent molars, I'm just going to make it bigger, permanent molars tend to have more secondary and tertiary anatomy the more posterior they are positioned. So secondary and tertiary anatomy, what that refers to is it has more grooves. So secondary means it has more grooves than the first permanent molar. So the second molar has more grooves. Tertiary anatomy means it has even more grooves and more pits and more anatomy. It's more wrinkled. And you can see that here. Maybe not so much, but if you look at the first molar, we can see some grooves. But when you get to the second molar, we see even more grooves. So this is like secondary anatomy. We're seeing even more grooves. When we get to the third molar, tertiary anatomy is happening. You're seeing a more wrinkled appearance. You're seeing a lot more grooves. So the more posterior you go, the more wrinkly they become. Roots of molars tend to be shorter and closer together the more posterior the molars are positioned, and the roots are often fused into one once you get very posterior. And that's exactly what I was showing you earlier, right? When we were looking at the roots, we noticed that the roots were getting closer and closer and closer together. So see how it's far apart here, and then it gets closer, and most of the time it can be fused. By the time you get to the third molar, it can actually be all fused together. We don't see that here, but it is very likely that it can be fused. The more posterior the molars are positioned, the more variation of anatomy is evident. So when you get to the very posterior teeth, so let's get to the very posterior teeth, the anatomy of that tooth looks a lot more different. And so that's very true, because the third molars look very different in people's mouth. And that's because by the time you get to the most posterior teeth, so this one could look similar, your first molar and my first molar could look similar. Your second molar and second molar could look, fairly similar. But once we get to the third molar, it could vary a lot in anatomy. It could look very different Your third molar could be very different from my third molar. All right, so let's look at some important points for incisors. So this is a central incisor, and what I want to show you with the central incisor is that if you look at the crown, so this is the crown, this is the root, it is wider mesiodistally. That means from the mesial to the distal, it is quite wide, especially if you compare it to facial lingual. So facial lingual, this is the facial, this is the lingual. If you compare the length this way, mesiodistally, it is longer compared to facial lingually. It is convex on labial. So if you look at the labial, it does protrude outward. It convexes like this. It convexes, and it's concave on the lingual. So it dips in on the lingual. It bulges out on the labial. Labial is towards the face. Lingual is towards the tongue. And this is, I'm just going to focus on the important points. Okay, so the mesio-incisal angle is sharp. So this, do you see how this is quite sharp over here, whereas the distal is more rounded? That is an interesting point to know. So if you're ever figuring out, what's right and what's left, and you have two teeth that you're, distinguishing between, look at the mesial and find that the sharp angle, the 90-degree angle, and when you see that, that tells you that that's the mesial side. When you see the rounded, that tells you that that's the distal side. So what tooth do you think this is? Do you think this is the 1-1? Or do you think this is the 2-1? Do you think this is the right, your right or your left? This is the 1-1, because the 1-1, it has a sharp mesio-incisal angle and a rounded distal. Okay, let's look at the lateral. So the lateral incisors, when you compare it to the central incisors, it's a little smaller. So central incisor is a little bit more wider. And same thing here. It does have a mesio-incisal angle and then a rounded disto-incisal line angle. Look at the depression of the concavity, so the curvature of the CEJ, sorry. Look at the curvature of the CEJ. You can see mesially is more curved compared to distal. In fact, mesial is 1 millimeter more curved compared to distal. So the lateral incisors are, actually, we're going to move on to mandibular incisors. So the mandibular incisors are smaller than the maxillary central or lateral incisors. In fact, it's a really small teeth. And what's unique about the mandibular central incisors is that it is so hard for us to distinguish the left from the right because they look the same on both sides. The mesials and distals look the same. The lobes on the mesial and the lobes on the distal appear identical. So it is quite hard to distinguish right versus left. But again, you got to look really closely, and if you look really closely, you can actually see the mesio facial line angle and then a slight curve on the distal. You can also look at the root, and the root curves more on the distal. You can also look at the CEJ, the cervical line. This is also known as a cervical line or the CEJ. You can see that the height of the curvature is more on the mesial compared to on the distal. And root tip does have a slight distal curve, as we mentioned. Now the lateral incisors, the mandibular lateral incisors actually is larger than the mandibular central incisors. So when we were looking at the max, the top, the central incisors were bigger compared to, or were wider compared to the lateral incisors. With the mandibular side, the central incisors are smaller, the lateral incisors are bigger. Let's look at the canine. I want to show you the maxillary canine. Okay, look at the lingual side of the maxillary canine. Then look at the lingual side of the mandibular canine. What's the biggest difference that you notice? Here again, maxillary canine. Here again, mandibular canine. Do you notice that the mandibular canine lingual surface is like quite smooth? It doesn't have that many ridges. It doesn't have a huge well-pronounced cingulum. And the fossa, that depression, it's there, but it's not as pronounced. But when you look at the maxillary, it has, very prominent ridges. It has a deeper fossa. It has a well-developed cingulum. This right here, this bump right here is the cingulum. And here the cusp tip is right over the root. So if you look at the cusp and you kind of align it with the root, the cusp tip is directly over the root. Whereas here, if you look at the cusp and you draw a straight line, it's a little bit off. Okay, let's look at premolars. So we're going to look at the maxillary first premolars. Remember, maxillary first premolar is your exception because it has 2 roots. All other premolars have 1 root. Maxillary first premolars have 2 roots. Now let's see another way to figure out whether this is a first premolar or a second premolar is you can check another way you can check whether, let's look at the facial and the lingual aspect, so the buccal and the lingual aspect. This is something interesting to note. With the first premolars, look at the cusp tip. Do you see how the facial or the buccal cusp is bigger, is larger, is taller compared to the lingual? Do you see that? This is taller compared to the lingual. So that's something unique about the maxillary first premolar. One side, one cusp, is higher compared to the other cusp. So the facial or buccal cusp is higher compared to the lingual cusp. When we look at the maxillary second premolar, we only have 1 root. And when you look at the cusp height, they're kind of equal. Do you not see that? Look at their facial and lingual cusp are nearly the same height, so they are kind of equal. Whereas when you look at the maxillary first premolars, we notice that discrepancy in the height. The facial cusp is longer compared to the lingual cusp. So that's something unique about the second premolar. When we look at the mandibular first premolar, so we're looking at the bottom now, the mandibular first premolar, we can see here that we have a higher buccal cusp and a lower lingual cusp. Another thing to note is that when you look at the buccal side, do you see how it rounds out, like it has a rounded shape over here? That is, when you see that roundedness, that is close to the cheek. When you see it being flat, that is close to the tongue because the tongue needs space, and so it's more flat on the lingual side, more rounded on the buccal side. So if you ever are unsure of which way to position the teeth in the person's mouth when you're trying to figure out the anatomy, remember that the rounded side always goes towards the buccal, the smoother side always goes toward the lingual. When we're looking at the mandibular second premolar, what we want to keep in mind here is that they actually have a central pit. So everything meets right here at the central. With the mandibular first premolar, let's go back so I can show you. So mandibular first premolar, here we go. It says there's no central pit. There's nowhere really right in the middle. It is not. There are pits, but it's not a central pit right in the middle. But with the mandibular second molar, you do have a central pit, which is right in the middle. It is pentagonal. So if I were to draw a pentagon, it would actually fit really nicely in this premolar. So here we have, a pentagon has 5 lines. That is a pentagonal outline. So occlusally, it looks like a pentagon. And that's what we can see over here too. This is, if you remember from before, this is a Y-shaped premolar which has 3 cusps. And there's no transverse ridge. Transverse ridge, if you remember, it means that there would be a ridge here, and then there would be another ridge here, right coming from that. But there's no ridge. There's only grooves. I don't see a bump, a proper bump. So there's no transverse ridge in the mandibular second premolar. At least I don't see any ridge in this mandibular second premolar. When you look if you look right from left, you will notice that the mesial typically, it's not prominent here, but the mesial has a greater curvature. If you look at the cervical line, it has a greater curvature compared to the distal. All right, let's look at the molars. So with the molars, you could have anywhere from 3 to 5 cusps, and there's at least 2 cusps or 2 rounded mounds on the facial side. So when we look at the maxillary first molar, there is something unique about the maxillary first molars, or all maxillary molars, is that they have 3 roots. But with the maxillary first molar, there are 5 cusps. And do you remember what the fifth cusp is called? This one right here. What is that fifth cusp called? Cusp of Carabelli. That's right. Okay, so that fifth cusp is the cusp of Carabelli. And so there are 5 cusps in your maxillary first molar. When we get to the second molar and third molar, there is not 5 cusps. The second molar has 4 cusps, for example. You can see that the roots are more flared over here. When you look at the maxillary second molar, I don't know why I said secondary here. When you look at the maxillary second molar, I'm just going to fix that right now. When you look at the maxillary second molar, look at the roots. The roots are more closer together, right? The roots are close together. There is no fifth cusp. In fact, there's 4 cusps. 1, 2, 3, 4. 4 rounded mounds. Round mounds. And then if you look at the distolingual cusp, which is right here, it is small. So typically the smallest cusp is your distolingual one, and it's even smaller than the first molar. The cusp over here is even smaller. Lastly, when we're looking at the third maxillary third molar, let's look at what's happening here. See how the roots are mostly fused? So the roots could either be fused or really, really close together. And they look a lot more wrinkly. Okay, so remember, there's tertiary anatomy happening here where there's more grooves, more wrinkled appearance happens with the maxillary third molars. If you look at the roots, it tips distally, and you can see that, right? It does tip a little towards the distal side. Mandibular first molar. So in the mandibular first molar, we have 1, 2, 3 facial cusps, and 1, 2 lingual cusps. And again, just like your first molar in the max, we have 5 cusps. In your mandibular first molar, we also have 5 cusps, but there is no cusp of Carabelli. Cusp of Carabelli is only in your maxillary first molars. The roots are wide and separated, but when we get to the second and third molar, the roots get closer together. Here's the second molar. The roots are a little closer together, especially if you compare it to the first molar. It does look a little closer together. What is unique about the second molar is you can actually draw a cross right here. They have well-defined occlusal grooves, which means that you can form a plus or a cross right here, and it's like almost equal cusps. So that's what's unique about the second molar. You can't draw a proper cusp with the first molar because it has that fifth cusp, but you can draw a cross here with the second molar. And then when we're looking at the third molar, we know that they have secondary and tertiary anatomy, so it looks a lot more wrinkled. The roots are actually shorter too, and they could be fused as well.